Hey guys, Dr. Cartwright here. Want to make another video showing y'all how to rehab the low back and try to get some strength back in these muscles so that you have less pain and more stability. So we're going to start with a brace position, and we're focusing on this part of the low back, the small low back, right at the lumbar spine. You can do this in your bed, or you can do it on the floor, whatever is best for you. But you know, a lot of our patients beginning to start in your bed, so they're not worried about getting up off the ground. So I'm going to use this bench here as my bed. And I'm going to start in this position here where my legs are bent and my body's flat. And what I want to do is I want to flatten my low back against the bed. Now, one way of doing that is imagine you have a balloon in your tummy. As you take a big inhale through your stomach, you're going to expand the balloon and flatten your low back against the bed. Now, I'm going to hold it there. I'm going to brace it there. Now, as I exhale, I'm going to push it a little harder. Nothing super intense where you hurt yourself, but brace your low back against the ground. Now, from the brace position, I can do some other exercises. I can lift the leg like this. I can put it back down like that. I can do it again, okay? Staying braced. Now, if your back pops up, you gotta go back to the breathing exercises that we did initially to help reinforce that brace. Now, another one I can do is where I have my leg up already. I'm braced. I kick it out like this, and I bring it back in, okay? Now, when we do these types of exercises, these rehab exercises, guys, they should be very high rep. In the beginning though, if you can only do 5 or 6 per position, that's all you can do. But the goal should be 10 to 20 to 30 per exercise. Now, if you wanna make those first two a little harder, we can start with our legs up like this, with my my low back braced. I can bring it down, I can bring it back up, or I can kick it out, I can bring it back in, okay? Those are some exercises for the hip flexors and low back. Another great one to do for your glute muscles and your hamstrings is what's called a bridge exercise. And what you do is you start from your brace position. I just lift my butt up like this. I can hold this position, and I can bring it back down. Now, there's a couple ways of doing this one. We can either do shorter reps where I hold it for a couple seconds, I bring it back down, and I just do a bunch of reps, or I lift it up and I hold this position for an extended period of time, whether it's a minute or two. You should be feeling it in your glutes and in your hamstrings. Okay? All right, so guys, that's some exercises for the kind of the posterior chain, low back, hip flexors. Hope those help, and any questions, just let us know.